Hello, this is your host Varsha Singh for Healthline TVAsia Telugu channel. Thank you so much for watching this show every time. And today I'm continuing another episode of Sathi series. Sathi is South Asian Total Health Initiative, which is a non-profit organization in New Jersey, and the physicians and healthcare providers of Sathi, their main goal is to educate the community. Today, I'm bringing a topic to discuss with our guest, Dr. Sneha Jacob. This topic is very important and essential. It holds a lot of significance in our life. And when we go further, you will understand what I'm talking about. HIV. Yes, we need to talk about this infectious disease. HIV is a chronic infectious disease that impacts about 2.1 million people in India and about 1.2 million people in United States. Due to cultural stigma, many South Asians are reluctant to talk about this. Lack of conversation about HIV can hurt ourselves, our loved ones, and our community. Just because this disease carries some degree of stigma, we should not stop talking about it. We need to talk about it. We need to have a conversation with each other, among us, with our community members. So, before we go further and discuss this with our special guest, Dr. Sneha Jacob, I have a special segment on the topic of HIV among South Asians and Indians in America. Today, we are going to begin with something different. Before we discuss, let's start with a story. This is a story by Aditi, an Indian woman with HIV who migrated from India to North America. I really encourage you to listen to this story carefully. So let's listen to her story now.
I was the youngest child of a very big family and was raised by my grandma, whom I loved with all my heart. When I was in high school, I met a guy and we started dating. We eloped. I got pregnant and he left me back home with his mother. I gave birth and got very sick and lost a lot of blood. I needed a blood transfusion, so one of my family members said that if he couldn't save my life, he could at least save my baby's, and the doctor took his blood. A few months after giving birth, my baby passed away, and I left to come to this country with my husband. I got pregnant again, and that's when the family member who gave me blood called and told me that he had just found out that he was HIV positive. He told me that I needed to get tested. I prayed to God that my husband and my child would be okay, but both of them tested HIV positive. I had my child tested again after a couple of years, and I was so relieved to know that the results came back negative. It was the happiest time of my life. From then, I started taking better care of my health and my family's health. When I found out I was HIV positive, I didn't have any emotional reaction to the news. I felt that I had to be strong. My doctor told me the news 3 times and he asked if I was okay. I reassured him that I was fine. When I arrived home, I told my husband that my blood work came back positive. My husband gave me a warm hug and told me not to worry because everything would be okay. He wasn't angry because he had faith in me and trusted me, and he said he loved me no matter what. I was so thankful for his support. He didn't judge me. We were in this together. At the time when both my husband and child had been diagnosed HIV positive, I felt like I wanted to die because I had infected the most innocent member of our family. But I told myself I had to be strong for everyone's sake so we could pull through the crisis. I turned to my faith to help me cope. All the prayers I recited came true for me when my child was retested and was diagnosed HIV negative. But the virus did catch up with me, and after a few years, I got really sick and had to go to emergency. After 1 hour, they pronounced me dead. For 45 minutes, my body was lifeless. The doctor called my husband to tell him the news. As he was doing that, two nurses came into my room and they saw me sitting up on the gurney. They ran off screaming and called for the medical team to come and see me. The doctors asked me questions to make sure I was really okay. After a few minutes, I saw 3 doctors and they started asking me questions like, was I okay? I got all my vital organs checked again and everything was normal. I didn't sleep for 4 days because I was so scared that I would die again. I don't tell anyone outside my immediate circle of family and close friends about my HIV status because I don't know how they are going to react. I keep it to myself. But it's very hard to have to hide it all the time because I get sick very often. My friends and relatives ask, I have to lie and tell them that I have cancer or another chronic illness that is more socially acceptable. If they ever found out what I really had, they would spread the news to others in the community. I've heard people say that if someone has HIV, they don't deserve to live. I don't subscribe to that way of thinking. I've come a long way through my own experience living with HIV. My faith has kept me strong. I believe in God, and whenever I have had bad days, I'll go to the temple and sit there for hours until I get my fill and I feel good again. I often hear a voice in my head telling me that everything will be fine. My doctor is also a big support. She calls me her miracle patient because I always have a smile on my face no matter how bad the illness can get. I have a very strong belief in my ability to overcome. I know in my heart that God is with me and that nothing will happen to me until my time comes. I tell my family this all the time, and I encourage them to be happy and to enjoy their lives. I like doing my garden. I feel free from stress and I love looking at the flowers. They make me feel good about myself. Most importantly, I love spending time with my family. My family means the world to me. Every Sunday, we have family meetings where we share with each other everything that happened during the week. Sometimes we go out for dinner or a movie or a long drive so we can spend some quality time in one another's company. 20 years ago, I was very sick and everyone thought I was going to die. But I'm still here, living, breathing, and loving all that I am, and every moment I am alive.
Thank you for listening. That was a story, What Doesn't Kill You by Aditi from the magazine More Than Fiction. As women share their stories, published by the Alliance for South Asian AIDS Prevention Organization in Toronto, Canada. So let's talk to our special guest today. We have Dr. Sneha Jacob with us today in Healthline by TVAsia Telugu channel. Dr. Sneha Jacob is an HIV physician and Assistant Professor of Medicine at Rutgers and Robert Wood Johnson Medical School. She is also Director of HIV Clinical Services at the Rutgers Eric B. Chandler Health Center in New Jersey. She has been the leader and she is leading a novel endeavor by the South Asian Total Health Initiative, which is a project to create HIV awareness in South Asian community. Let's start by asking her to tell us what led her to start this initiative. So, Dr. Jacob, please tell us your aim, your goal when you came up.
I want to thank you, Varsha and TV Asia, first off, for inviting me here today and for hosting the Sati Healthline series. And before I go any further, I also want to thank the rest of our team who have worked so hard to make this initiative possible. Vishaka Goshal, Shalja Mathur, Minu Norwood, and Dr. Sunanda Gaur. A big thank you also to the many Rutgers University students who have volunteered with us along the way. So Varsha, we started this initiative because as a doctor, I was beginning to see more and more people who migrated from India coming to me for HIV care here in New Jersey. Many were coming at the point that they were very sick with AIDS, and it's because they did not have the HIV test early on. My own parents migrated from Kerala, India, so I understand firsthand that there are many cultural barriers to care. It was the stories of my HIV patients from India that led me to start this initiative.
Thank you so much, Dr. Jacob. This is an important issue, and we really do not talk much about HIV as much as we talk about flu or right now COVID. This is most talked about disease right now. But we know that this HIV, the knowledge about HIV is equally important. So first question, and as you are an infectious disease specialist, I would really like you to explain our viewers what is HIV and is it the same thing as AIDS?
So it's a great question, Varsha, and especially in the current situation of the coronavirus pandemic, HIV is also a virus. And it's a virus that specifically attacks the body's immune system. HIV causes AIDS. So AIDS is acquired immune deficiency syndrome, and it is a condition in which the body's immune system becomes very severely weakened. AIDS can in turn result in severe illness, for instance, other infections, cancers, and it is these that can finally lead to death.
Thank you for explaining that, Dr. Jacob. It makes sense that the virus and disease, it's two different terminology. Thank you so much. So as we listen to the story by Aditi, I wanted to shift back to the same story and ask you, in that story, Aditi was infected by HIV through blood transfusion before she left India. So if you can tell us, is that a common way that people can get HIV? Because there are other ways, the knowledge about HIV is you can contract it through different means. So if you can explain a little bit in detail, how is it possible that HIV can be contracted through different modes?
So, Varsha, it's actually not common to receive HIV through a blood transfusion. There are very strict protocols in place for the screening of blood products. And in the United States, the rate of HIV among blood donors is about 1 in 20,000. There were actually only 3 cases of blood transfusion-related HIV infection in the entire decade from 2000 to 2010. And there have not been any cases reported in the US since 2008. In India, however, the rate of transmission from blood transfusion was higher in the past, but it has really decreased over time. The most recent report is that it is below 1%. So protocols are in place in India as well. However, there is a shortage of blood in blood banks. In such shortage, family members may be the only source of blood donation, as they were in Aditya's story. Another problem is there's actually a growing black market, which creates incentives for people to donate blood for money, but without the proper screening.
Okay. So this is important to know, Dr. Jacob. So our listeners, they might be wondering, or the viewers, they might be wondering how safe it is to get a blood transfusion. What should we tell them? Should they be tested for HIV if they had even one blood transfusion in their lifetime?
So, our message to our viewers today is very different. It's actually that you should be tested for HIV regardless of whether you have had a blood transfusion or not. So, the Center for Disease Control in the United States has actually gone so far as to recommend that all people between the ages of 13 to 65 should have at least one HIV test in their lifetime. So HIV can be passed from one person to another in a few main ways. These are through sex, through sharing needles for injection of drugs, and through blood transfusion. As we heard in Adithi's story, HIV can also be passed from mother to child during the pregnancy, at the time of delivery, or while breastfeeding. HIV testing, especially in the United States, is free, and results can be provided in as little as 20 minutes. So it's quite easy to access these days.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన, సంతృప్తికరమైన లావాదేవీలను చేసిపెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 9083049621 or 9083371289.
Dr. Jacob, it seems like the getting HIV testing done is very easy in United States. And in my knowledge, I know that there are some protocols, especially it's for the women who are pregnant and they are going for their prenatal testing. It is very common to get the HIV testing done. And also there is another disease panel that they run. So when HIV testing is so easy to get done here in USA, why don't you think that our South Asian population is getting tested? Why aren't they getting tested even once in their lifetime?
So that's a great question, Barsha. And as you pointed out, many individuals, South Asian and other cultures, actually get tested at the time of pregnancy because it's a mandate here in the United States. So I recently led a research study at Rutgers University in which we surveyed 868 South Asians here in central New Jersey. When we did that, we found that only 1 in 5 said that they had ever had an HIV test. So the people who told us that they were more likely to be tested were the ones who were more educated or more aware about HIV. And those who were more likely to be tested were also those who said that they were willing to discuss HIV with their partners. That is why, Varsha, we are working so hard to inform people about HIV in the South Asian community so that they will get tested.
Yes, Dr. Jacob. And for just similar to many other screenings, just like how we do cancer screening, early diagnosis, early treatment. But the question still remains, many South Asians may think that they don't need to get tested. for HIV, especially because it doesn't apply to them. What do you say to that?
So you're right, Varsha. When our team goes out to talk about HIV at South Asian community events, often people will tell us, no, thank you. I don't need that information. It's not relevant to me. Many people believe that HIV is only an issue for what they call those people. For instance, gay men, drug users, sex workers, and so on. So if you who are watching this show today are someone who has ever said this, then you would actually be surprised to meet the people living with HIV that I take care of. In the 12 years that I've been an HIV physician, I have seen people of all races, ages, religions, really from all walks of life. Currently, I'm caring for a 79-year-old Indian woman with HIV who comes to see me here in clinic in New Jersey wearing her sari. Few people who look at her would ever think she has HIV, but you'd be surprised. That's why everyone should be tested. In the slide that we're looking at now, I have included statistics on HIV specific to India, which is the largest country in South Asia. And as you can see, the large population results in a very large number who are infected, 2.1 million. These people can then go on to infect others in India or when they migrate abroad to places such as the United States.
That's very staggering statistics that you have shared. And the way you're explaining that the very reason of getting a test done is just to check that box off that I'm okay. And if it turns out to be a positive test, then it also gives a perspective to that individual to take all those preventative measures so that they do not spread it to other people, especially it will be their family members and people around them. So thank you for pointing that out, and it will give our viewers a perspective, and they will have time to think about it, that should I get this test done? In Aditi's story, if we go back to what we have heard in the beginning of this episode, her husband seemed very supportive of her HIV status. Um, what would you say about family support? Are families often supportive in your experience?
So it depends. I find that the support of the family will actually rely on their knowledge about HIV. So many of my patients' family members come to me and ask, can I drink out of the same cup? Can I use the same toilet? Can I give my family member with HIV a hug? And the answer to all of these questions is yes, because you do not get HIV from sharing dishes or sharing a toilet seat or giving a hug. Yet in our research study, so many South Asians that we surveyed did not answer these questions correctly. And what's needed is that a community really must first be empowered with correct knowledge so that it can support its members who are infected with HIV. This is the way to keep HIV from spreading.
Thank you for that important tip and correcting the myth that is associated with HIV infection. Because it takes an emotional toll on the patient who has tested positive and definitely needs support of the family and friends around them. And again, going back to Aditi's story, I wanted to ask you one more question. I was surprised by the point in her story when Aditi said that when she gave birth to her child, the child had tested HIV positive at the time of birth. But few years later, the same child was retested, and they found that now this child is HIV negative. This can be something like sound like mystery, and viewers may be thinking, how can this happen? Can you explain that how this could have happened?
Yeah, so this was a small miracle, considering that it's actually not clear from the story whether Aditi had started HIV treatment when she had the baby or before she had the baby. So just to clarify to the viewers today, Aditi is not my own patient. However, in my own experience, many of my young patients who have been recently diagnosed with HIV will ask me, Dr. Jacob, does my having HIV mean that if I have a child, that he or she will also have HIV? And the answer to that is no. Just because you have HIV does not mean that your future children will have HIV. So when a pregnant mother takes HIV treatment, her risk of passing HIV to her child is less than 1%. If she is not taking HIV treatment, her risk of passing HIV is as high as 25%. That means 1 in 4 babies can be born with HIV if their mothers do not take treatment. And to answer your other question, Varsha, the reason that Aditi's baby first tested positive and later negative may have had to do with the manner of testing for HIV in infants. So our traditional test for HIV is to check an HIV antibody, and that is a protein produced by the body in response to the presence of an HIV virus. When a baby is still in the HIV-infected mother's womb, she receives all of her mother's antibodies, including the HIV antibody, which is positive. This does not mean that the baby has been infected with the actual HIV virus. The HIV antibody of the mother can actually be detected in that child for up to the first 18 months of life. After that, the child's own antibodies start to take over. And if she or he has not been infected with HIV, she or he will start to show a negative antibody test at that time. So again, by treating the mother for HIV before and during pregnancy, we can essentially ensure that that baby will not be infected by the HIV virus.
Thank you for explaining that, Dr. Jacob. It really explains in scientific manner why that phenomenon happened. We are using Aditi's stories as kind of a guideline during our discussion and answering a lot of questions that our viewers may have about HIV. Aditi told us in her story that after a few years, her HIV virus caused her to get really sick and have a near death experience. Does finding out that you have HIV mean you are going to die soon? Um, what is the longevity associated with this infection?
So thankfully, Varsha, with the advancements that have been made in HIV treatment in these last few decades, HIV is no longer a death sentence. Once you are diagnosed with HIV, if you start treatment and remain on it, you can actually have a normal lifespan, and this has been proven by research. The treatment that we use today is as simple as 1 pill a day with very few side effects. Currently, I take care of 400 people living with HIV at a health center in New Jersey. Many of my patients have been coming to our clinic for more than 20 years, and they're doing remarkably well. Whenever a person is newly diagnosed with HIV, whenever they start coming to me for care, the first thing I tell them is that you can have hope. You can still have a full life. Your life will be different, and you will be taking medication every day from now on. But that does not prevent you from having a family, working, traveling, or achieving your goals. Things will not always be easy. However, at our health center, we have an excellent HIV healthcare team that is there to support you. My mission as a doctor is to let people know that along with their HIV medical care comes a reason to have hope. That's hope for improving your physical, emotional, and spiritual well-being. The people I care for who live with HIV are not simply surviving, but thriving. And theirs is a story of courage and perseverance, just like the story of Aditi. One thing I do want to say before we end is that there's a Facebook page that we have through our organization, Sati. If you have any questions about HIV or what we've talked about in this show today, please come on our Facebook page and contact us. We'd be happy to hear from you.
Actually, Dr. Jacob, you answered the question even before I asked you about the resources that our viewers can look at if they have any question, where they can go to read more about HIV. And you also narrated your own mission. It is to empower people with the knowledge about this disease and also urge them to do the right thing, which is get tested at least once in their lifetime. So I want to thank you for your time and expertise in this episode and talk about a serious condition and infection such as HIV, which many people are reluctant to discuss about. Do you have any final words for all our viewers who are going to give it a thought about this infectious disease and make the right choice, that is to get tested at least once?
I'd like to say that getting tested is very easy. It's very quick, and it's something which is so important for all of us to do, to know our status with regard to HIV, and it will really help us as a community, because it can help to control this epidemic, which has been around for more than 30 years, and which we are trying to reduce in number, and especially in the South Asian community. So I would encourage you to talk more about HIV with your friends, with your family, and to make this condition less stigmatized and something that we embrace as a chronic medical condition, just as we do diabetes, hypertension, heart disease. And not to ostracize the people living with this condition, but rather embrace them into the community.
Thank you, Dr. Jacob. I really appreciate your time and coming to Healthline TVAsia Telugu channel and sharing your experience, as well as bringing forward Aditi's stories so that viewers can really give it a thought. Dear viewers, this episode has given you a perspective to look at HIV in different light, just as another infectious disease, and not something that we should attach social stigma to. This is a physical condition. It has treatment option, as Dr. Jacob told us, and the best way to treat early is to get tested early. So if you like this episode, please come again and watch us on Healthline TVAsia Telugu channel, because we will have many more such interesting and informative health-related issues discussed in each episode. I'm your host Varsha Singh, saying bye for now, but I'll see you again in my next episode of Healthline on TVAsia Telugu channel. Thank you for watching.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన, సంతృప్తికరమైన లావాదేవీలను చేసి పెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 9083049621 or 9083371289.
అంజలి నీకిదే, అంజలి నీకిదే, అంజలి నీకిదే, అంజలి నీకిదే, అంజలి నీకిదే, అంజలి నీకిదే, శ్రద్ధాంజలి నీకిదే. అనగానగా స్వరముల కథలో గొంతుక మిగేను మౌనమై, అనగానగా శృతిలయ ఝరిలో నింగికి ఎగసెను ప్రాణమే. అంతలోనే మమ్ము విడిచి వెళ్ళిపోవడం న్యాయమా? అనగానగా కథలో గొంతుక మిగిలేను మౌనమై.
అనగా అనగా శృతి లయ ఝరిలో లింగికి ఎగిసెను ప్రాణమే.
అందించారుగా గాన సూత్రం తెలుగు పదమే ఏటగా. నేర్పించారుగా గాత్ర ధర్మం తెలుగు తనమే జన్మగా. రాగం తానం పల్లవి చారున దేహం ప్రాణం పాటగని నిలిపిన నిన్ను మరువగలా. అనగా అనగా
స్వరముల
కథలో గొంతుక మిగిలేను మౌనమై. అనగా అనగా శృతి లయ ఝరిలో లింగికి ఎగిసెను ప్రాణమే. నీ పాదములే కలివేదిక శివరంజనులే పాడమా. నిరిగమనమరి గరి నిద నిరిగమనని మనిద గరిగ గరిగమనని మదని నిద. మీ శ్వాసలలో చేరని పాటిక జనరంజకమే కావుగా.
నాసికదంత్యము అక్షరదోషము
గాయక లోకం నేర్చుటేనా మీరు లేని గణమా. అనగా అనగా స్వరముల కథలో గొంతుక మిగిలేను మౌనమై. అనగా అనగా శృతి లయ ఝరిలో లింగికి ఎగిసెను ప్రాణమే.
పుంజు తినట్రా
కూడా 1 2 3.
సార్ మీరు ఈ కాలేజీలో బాగా ఫేమస్ అంటే కదా సార్? సార్ లవ్ స్టోరీ ఈ కాలేజీలో బాగా ఫేమస్ అని చాలా విన్నాను సార్. ఒక్కసారి మీ లవ్ స్టోరీ చెప్తారా సార్?
అది
సార్ 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 ప్లీజ్ సార్. సార్
మరీ మొబైల్ పెట్టు. ఓకే
తనని కాలేజీ ఫస్ట్ డే చూసా, టాకింగ్ ట్రైలే వేసా, తన ఫోన్ నంబర్ సంపాదించేసా, హాయ్ హలో వాట్సాప్ లో స్టార్ట్ చేసా. ఫస్ట్ ఇయర్ టాపర్ ని నేను, అది చూసి ఇంప్రెస్ అయితాను. తన లుక్కులతో హిట్టింగు నన్ను, ఫుల్ ఫీల్ అయ్యి హెల్పింగు నేను. సెకండ్ ఇయర్ వచ్చాక హ్యాంగ్ అవుట్ బంకులు, థర్డ్ ఇయర్ కొచ్చాక నా ఫీలింగు పెరిగేసి మెల్లంగా బ్యాక్లాగులు, నాపై నాకే కంట్రోలు. ఫైనల్ ఇయరులో క్లారిటీ వచ్చి మంచి రోజు చూసి రెడ్ ఫ్లవర్ ఇచ్చి ఐ లవ్ యూ ఐ నీడ్ యూ అన్నానే. చిచ్చి నేనట్టా నిన్ను చూడలే, మంచి ఫ్రెండ్ అనుకున్నానే అంటూ ఫ్రెండ్ జోను చేసేసి యుఎస్ చెక్కేస్తే ఇప్పుడు నా పరిస్థితి ఏంటి?
పిల్ల బొక్కెట్టే
అయిందేదో అయింది ఆపండ్రా. బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే తుహారా ఎల్లో పులిహారా బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే తుహారా బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే అయిందేదో అయింది ఆపండ్రా.
FIA presents Dance Pay Chance Virtual Live Solo Dance Competition 2021 in search of America's best Bollywood dancer. Grand Finale, Mega Performance, Grand Prizes. February 22nd and 23rd, 2021 at 9:30 p.m. EST. Celebrity judges Sudha Chandran, Indian film and television actress Firoz Khan, Bollywood choreographer, guest of honor Laya Gorti, Indian actress and Kuchipudi dancer. Download FIA DPC app to vote. Prize winners will be announced on 23rd. Watch live exclusively on TVAsia Telugu. TVAsia Telugu now available on Yup TV.
Don't spend more money in selling your home. Instead, make more. For all your real estate needs, trust only Lovi. Lovi Realty Group makes it easy to sell your home. The Lovi Sale by Owner offers the same services as a realtor does for a fraction of the price. For only $990, we list your home, handle digital marketing, take calls, and schedule home showings for you. Planning to buy a house? Lovi has the best tools and agents to make your journey happy. We offer home buyers rebate of 1% or more cash back towards the closing. Visit our website to learn more about our programs. www.lovihomes.com. For more details, please contact 908-304-9621 or 908-337-1289.
న్యూజెర్సీలో ఇల్లు కొనాలని కానీ అమ్మాలని కానీ అనుకుంటున్నారా? మీ నమ్మకమైన నేస్తంగా మీ ఇంటి క్రయ విక్రయాలను చేసి పెడుతోంది మీ లోవి రియల్టీ గ్రూప్. వేలాది డాలర్ల మీ కష్టార్జితాన్ని, ఎంతో విలువైన సమయాన్ని ఆదా చేస్తూ కేవలం $990 నామమాత్రపు ఫీజుతో ఖచ్చితమైన సంతృప్తికరమైన లావాదేవీలను చేసిపెట్టే రియల్ ఏజెన్సీ లోవి. అంతేకాదు, మీరు కొన్న ఇంటి మీద మినిమం 1% క్యాష్ బ్యాక్ మీ క్లోజింగ్ కాస్ట్ లో పొందగలరు. మరిన్ని వివరాలకు ప్లీజ్ విజిట్ www.lovihomes.com. కాంటాక్ట్ 908-304-9621 or 908-337-1289.
కొంచెం తినట్రా. ఒకటి
రెండు మూడు.
సార్ మీరు ఈ కాలేజీలో బాగా ఫేమస్ అంటే కదా సార్? సార్ లవ్ స్టోరీ ఈ కాలేజీలో బాగా ఫేమస్ అని చాలా విన్నాను సార్. ఒక్కసారి మీ లవ్ స్టోరీ చెప్తారా సార్?
అది
సార్ 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 ప్లీజ్ సార్. సార్
మరీ మొబైల్ పెట్టు. ఓకే.
తనని కాలేజీ ఫస్ట్ డే చూసా, టాకింగ్ ట్రైలే వేసా, తన ఫోన్ నంబర్ సంపాదించేసా, హాయ్ హలో వాట్సాప్ లో స్టార్ట్ చేసా. ఫస్ట్ ఇయర్ టాపర్ ని నేను, అది చూసి ఇంప్రెస్ అయితాను. తన లుక్కులతో హిట్టింగు నన్ను, ఫుల్ ఫీల్ అయ్యి హెల్పింగు నేను. సెకండ్ ఇయర్ వచ్చాక హ్యాంగ్ అవుట్ బంకులు, థర్డ్ ఇయర్ కొచ్చాక నా ఫీలింగు పెరిగేసి మెల్లంగా బ్యాక్లాగులు, నా పైనకే కంట్రోలు. ఫైనల్ ఇయరులో క్లారిటీ వచ్చి, మంచి రోజు చూసి రెడ్ ఫ్లవర్ ఇచ్చి ఐ లవ్ యూ ఐ నీడ్ యూ అన్నానే. చిచ్చి నేనట్టా నిన్ను చూడలే, మంచి ఫ్రెండ్ అనుకున్నానే. అంటూ ఫ్రెండ్ జోను చేసేసి యుఎస్ చెక్కేస్తే ఇప్పుడు నా పరిస్థితి ఏంటి? బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే తుహారా ఎల్లో పులిహారా బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే తుహారా ఎల్లో పులిహారా అయిందేదో అయింది ఆపండ్రా. బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే తుహారా ఎల్లో పులిహారా బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే తుహారా బొక్కెట్టేనే పిల్ల బొక్కెట్టేనే అయిందేదో అయింది ఆపండ్రా.
Don't spend more money in selling your home. Instead, make more. For all your real estate needs, trust only Lovi. Lovi Realty Group makes it easy to sell your home. The Lovi Sale by Owner offers the same services as a realtor does for a fraction of the price. For only $990, we list your home, handle digital marketing, take calls, and schedule home showings for you. Planning to buy a house? Lovi has the best tools and agents to make your journey happy. We offer home buyers rebate of 1% or more cash back towards the closing. Visit our website to learn more about our programs, www.lovihomes.com. For more details, please contact 908-304-9621 or 908-337-1289.
పుంజు తినట్రా. ఒకటి రెండు
మూడు. సార్ మీరు ఈ కాలేజీలో బాగా ఫేమస్ అంటే కదా సార్? సార్ లవ్ స్టోరీ ఈ కాలేజీలో బాగా ఫేమస్ అని చాలా విన్నాను సార్. ఒక్కసారి మీ లవ్ స్టోరీ చెప్తారా సార్?
అది
సార్ 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 ప్లీజ్ సార్ సార్